Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
9:07 is the time. About a quarter of people with diabetes develop foot ulcers in their lifetime, and some of them are going to have a foot amputated to prevent loss of life. Dr. David Dean with the St. Vincent Wound Center is joining us today to talk about treatment for foot ulcers for patients who have diabetes. Dr. Dean, thanks so much for coming in. Appreciate you. And know that this is something that, diabetes is a disease that a lot of people have, and it's unfortunately you're seeing statistics grow even more with that disease.
That's correct.
Let's talk about some of the problems with foot ulcers, and really how did these wounds begin and how are they treated?
Well, the wounds begin because the diabetic patient loses both blood flow and nerve function to the foot, so they can't feel when they have an ulcer. So those patients have to inspect their feet every day to make sure that nothing's wrong with them. Pressure causes the ulcerations. They don't feel that they need to take the pressure off the foot. And as they progress, they don't heal normally because of the lack of blood flow. So we offer hyperbaric oxygen therapy to help restore that oxygen to that foot and help heal the wound.
Okay, hyperbaric oxygen therapy. What exactly does that do? We have an idea, at least with this graphic here, but kind of break down how long of a process is that?
The individual treatment's about 90 minutes. We bring the patient to 2 atmospheres in a chamber.
Okay.
And then we do those treatments sequentially for up to 40 to 80 treatments or until the ulcer's healed. The whole idea is bringing more oxygen to the tissue that needs to be healed. And it works by dissolving more oxygen in blood than the red blood cells can carry on their own.
How does HBOT, as it's called, how does that work exactly?
It's just, you're in a chamber, and instead of breathing just normal room air, which is 21% oxygen, you're breathing 100% oxygen.
Wow.
And then we double the pressure.
What kind of effect does that have on the body?
There are some things you have to watch out for.
Yeah.
In diabetics, they could get seizures if their sugar came too low, so we're very close on monitoring their sugar, giving them nutrition if they needed to keep their sugar in the right range. If somebody had previous collapsed lung, we would want to have that surgically corrected before they went in the chamber.
Okay, so there are some precautions to take.
Other than that, it's very safe.
Really?
And it's very protocol driven. It's almost like flying an airplane. Everything's done according to a checklist, very safety conscious. There's no experimentation or danger.
Let's talk about some candidates for this type of treatment. Who would they be, and who would be up for something like this?
Well, diabetic foot ulcers represent a huge portion of our patients. Other things are people that have had surgery that involved a moving of tissue, like a below-knee amputation where a flap is developed, or any kind of flap tissue transfer, skin graft that doesn't heal would be a candidate. People with necrotic infections, a rapidly developing infection that destroys tissue, is a candidate. And then some routine things like diving injuries, carbon monoxide poisoning, but we focus more on the wound aspect, so the infections, diabetic foot ulcers, and compromised flaps.
Okay, and now are there any diabetic patients out there, though, that should not have HBOT to treat foot ulcers?
Only those that we can't keep their sugar up would be not a candidate. We have to have a reasonable blood sugar in the chamber to do it. So we really focus on wounds that have been present 30 days or longer. We try conservative, straightforward wound care first, and then after that period we move to hyperbaric oxygen therapy.
Talk about some of the benefits of the therapy itself. You talk about how many, you said about 40 to 80 treatments total. Does it come out with a pretty good success rate?
It has an excellent success rate. More than 90% of our patients heal their wounds.
Wow.
Within the prescribed treatment time frame.
Okay, and when you talk about how many times they go in for treatments, is that every week, every 2 weeks?
No, it's a daily treatment once you start it.
Really?
And we do not work weekends, but we do it Monday through Friday. It's cumulative effect.
Okay.
So you want to keep a regular progression through the treatments to have a good result.
All right, and if anyone has any questions about it, obviously contact you guys.
Call us at the St. Vincent's Wound Center.
Okay, I want to remind everybody that number is 501-552-2700. 2660, and they're right there in Suite 120 on 1 St. Vincent Circle. Thanks so much for coming in, Dr. Dean. Really appreciate it.
Thank you for having me.
Happy New Year to you.
Happy New Year.